My name is Carrie Brennan, and I am a senior nursing student at Centera College. What is an issue that is detrimental for both patients and nurses today? Nurse understaffing. This problem has been ongoing, but has been exacerbated in recent years in part due to the pandemic. A cross-sectional study by Columbia University in 2019, conducted on 100,000 patients in a hospital, concluded that nurse understaffing was associated with more hospital-acquired infections in patients. These infections included urinary tract infections, bloodstream infections, and cases of pneumonia, all which can be fatal to a lot of patient populations. Another study conducted by the Journal of Advanced Nursing surveyed 120 frontline nurses during the height of the pandemic, between April and May of 2020. Results showed that reducing nurse staff in order to cut costs has led to employee burnout and poor patient outcomes. Epic reported that the demand for nurse staffing increased by 245% in late 2020. Clearly, something has got to change with this broken healthcare system in America. I recommend that there should be more financial and non-financial incentives for nurses to work and retain their positions. A financial incentive could be in the form of an increased federally mandated minimum hourly rate for RNs across the board. A non-financial incentive, which would attract and retain more nurse staff, is a healthy work environment. A different study, which surveyed 396 nurse practitioners in February of 2021, concluded that there is a 58% decreased risk of burnout in more favorable work environments. With the proper incentives, training, management, and representation, I believe that nurses would be more attracted and retained to the units that they work in. I also strongly recommend a federally mandated patient-to-nurse ratio cap, in which nurses are illegally unable to care for more than 5 medical surgical patients at a time. In California, the only state with an implemented staffing legislation, nurses are not allowed to care for more than 5 adult medical surgical patients at a time. After implementing their nurse staffing policy, California hospitals saw sustained improvement in staffing. Even in care settings with low budgets, this staffing legislation would be ultimately save billions of dollars in hospital-acquired injuries, infections, and illnesses due to safer nurse-to-patient ratios. In closing, healthcare and nursing staff is imperative now more than ever in America to keep it operating safely. How are we to expect nurses to keep patients alive when nurses are uncompensated, under-incentivized, and just simply burn out? Nurses are demanding a reform now before there are any more devastating statistics. With more attractive incentives and mandated nurse-to-patient ratios, I believe that we can change the future of healthcare entirely.